Yeah.
So Caroline, lovely, thank you. So Caroline Abrams is, I'm delighted, is joining us, Charity Director from Age UK, where you've worked for more than a decade. Caroline manages the influencing functions at Age UK, including policy, public affairs and campaigns, and is Age UK's lead media spokesperson. She's also one of 3 co-chairs for the Care and Support Alliance, which brings together at least 60 charities and not-for-profits to campaign for decent social care for all. And Caroline is currently co-chairing one of the working groups for the government's NHS 10-year plan, which would be fascinating, I'm sure. Previously, Caroline worked in central government and opposition, the local government association and the children's charity Action for Children. She was awarded a CB for services to older people and to the voluntary sector in 2021. So Caroline, we're delighted you're with us. Thank you so much. And I'll pass the microphone over to you for your talk. About 15 minutes, if that's okay with you.
Okay, I'll try and keep going that long. Or if I'm still at it, just tell me to shut up, okay? So
I'll do that. Thank you.
Wonderful, thank you. So I'm the jam in the sandwich between 2 friends, which is Nadia on the one hand and Rachel on the other, because we're all mates and we all work together all the time, really, and we're often in the same meetings. So it's nice to see my friends on this rather horrible Saturday afternoon, weather-wise. And I hope you're all okay in Darlington, where I think you might have got snow. So yeah, you be careful up there. So I'm going to try and think about what I can say that's going to be different to my colleagues, because essentially I think we probably all agree about almost all of it, really. You know, we all want decent social care system for everybody. You know, certainly organisations like Age UK wants to be supportive to providers who are often kind of stereotyped as all being terribly rich and successful and rolling in money, whereas actually the reality is a lot of them are very small businesses and charities operating on very slender margins. So they're not the bad guys, they're the good guys. And of course, the other good guys are all the staff who do a fabulous job, without whom we just, you know, we couldn't do it at all. I probably should just have mentioned too that probably like loads of people in the room, virtually and otherwise, I've also been a carer myself, and I certainly learnt a lot. When my mum was ill and I was helping to care for her for over about 4 years. You know, it's one thing to read about it, it's another thing to actually experience it day to day. So that informs my view as well. But I'm going to try and talk a bit about the politics, in a sense, to think about, well, why? I'm sure you've spent all day hearing about all the problems in social care, about how important it is, about how when someone gets good social care, it's absolutely transformational, makes an enormous difference to their life. And yet our system is quite obviously in a terrible mess and has been for ages. I mean, sadly, arguably, it's actually going backwards at the moment, not forwards, which is something it gives me no pleasure to say at all. But with the budget changes that Nadia was referring to, you know, arguably things are getting worse, not better. So the question I'm going to try and answer is why? And you might think me horribly cynical as I answer this. So let's see how it goes anyway. So I think people like Nadia and Rachel and me, we spend lots of time thinking about the reality of what it's like to be an older person or a disabled person, or in Rachel's case, somebody who is a patient of the NHS, and about how we can organise services to make life much better for people, and also make these good jobs for the staff so they're well motivated and all the rest of it. I don't think that dominates the political conversation about social care at all. And I've seen this firsthand as well, you know, in the corridors of power, as it were, because actually a very senior figure in government about 3 governments ago, and I know that's not very long actually, is it? We had such a turnover recently, but said, I heard him say, I was in the room when he was saying, actually the only thing most of the public knows about social care is that you might have to sell your house. And he's kind of right, actually, that a lot of people don't understand social care. Obviously, if you've had something to do with it, if you've cared for somebody, if you are a user, you know, all sorts of reasons bring you into contact with the social care system, then you absolutely see why it's important and understand it. But a lot of the public isn't in that place. And I think particularly around older people's care, a lot of the public doesn't want to think about getting older, and so tends to put off thinking about things like that. And so we know that there are still loads of people, loads of members of the public who still think it's part of the NHS, so they won't have to worry about it, it will be paid. Even today, there are still lots of people who are operating under that false assumption. And so this aforementioned politician reckoned that what he needed to do about social care was to speak to the public interest in basically not having to sell my house. Or actually, I think rather more honestly, it's not about whether an older person has to sell their house. It's about whether their next generation will inherit it or not. So in practice, I think a lot of the political conversation is really about inheritance. And it is about actually the fact that at the moment, so many people in later life who do need social care end up, of course, as I'm sure you've discussed today, spending really quite a lot of money. It's not cheap. It can't be cheap because of the nature of what it is. And then finding, you know, if they are self-funding, as Nigel was referring to, as increasing numbers are, of course, because the state's got meaner and meaner over the years, that actually they're having to take some of the equity of their house. And of course, the reality of the fact is nobody has to sell their house during their lifetime to pay for care, because you can get something called a deferred payment. You have to pay a bit of interest, but it means you don't have to sell during your lifetime. But after your death, that money might have to be given back. And at that point, obviously, inheritance isn't what it might otherwise have been. And I'm not just being sort of horrible about people who want to inherit, not least as someone who myself has inherited. But of course, we live in a world in which the economy is a bit stuck, in which house prices are very, very high in some parts of the country. So I don't blame people. We're asking a lot of people not to be conscious of the fact that, you know, mum's house in the southeast might be worth £1 million, and even though I might be working really, really hard as somebody with my family, and I'm working all the hours God sends, actually, I'm never going to earn as much as I might have fall into my lap in terms of inheritance. So I think that insight from that politician was largely right at one level. And of course, it's not what we spend our time thinking about in the social care sector, but it's what the politicians are conscious of, which is the great interest in the financial side of it. And of course, as Nadia has absolutely rightly said, social care is grotesquely underfunded. So why don't they do something about it, we might say? Well, I think the honest answer to that is because we haven't got much money as a country these days. We're a third poorer than we were before the financial crash in 2008. Various other things haven't helped. And there's no way that we as a country are going to be able to give people lots of free care. So that's gone. If it ever existed, that's not going to happen. So probably, if we want a better care system, we're all going to have to pay more for it. And I think that's the conversation that the politicians find it very, very difficult to have with the public. And actually, as someone who was not a big supporter of Sir Andrew Dilnot's scheme, I have to be honest, at least latterly, I think we supported it originally, but I think over time we decided it wasn't particularly where the priority ought to lie. The problem with the Dilnot scheme that hung around for years and years before politicians actually said they weren't going to do it, is that it kind of offered a hope to the public that someone might come in and pay their care bills for them. And in practice, actually, that was never going to happen, because that wasn't what the Dilnot cap ever did. It wasn't a cap, it was a subsidy, and you'd still have ended up paying lots of money, and it wouldn't have helped very many people anyway. None of that, of course, was ever discussed because that's all too difficult as well. But for that reason, lots of people, and we get contacted, of course, by lots of people at Age UK who are very worried about their care bills, completely understandably, and saying, well, actually, is there going to be a government policy? Will the Dilnot cap come in, which means that somehow we're going to be okay? And so I think, actually, the job for politicians now is harder than it was because of Dilnot, because of the hope that Dilnot was going to happen. And a lot of people are going to have to be disappointed that they're not going to get lots of money from the state to help fund their care bills. Which is not to say that I'm entirely negative about all of this at all. And let me just explain why. So it's interesting, the timing of this event, because On Monday, it is widely rumoured that the Chancellor of the Exchequer, the Prime Minister, and the Secretary of State for Health and Social Care are having a meeting to talk about what to do about social care. This was publicised by Laura Kuenssberg in a BBC blog last week or the week before. And I think what's happened is they've reached the point that every previous government has reached, that they've been in power for a bit. They've realised how awful social care is, how rickety the system is, and they're thinking, oh my goodness, what are we going to do about it? And previously, very often when governments have had that conversation, they come to the conclusion that anything they did to reform it or to refinance it would be so politically difficult, it was better to just put little dribs and drabs of money in it to keep it staggering on, which we may all feel is wholly unsatisfactory and very cynical. But it's partly, I think, because of the political difficulty I've just pointed out, that people don't want to have to say to the public, sorry, you're going to have to pay a lot more money for this, that therefore it's easier politically to just keep staggering along and letting down people like Nadja and her colleagues and her staff, not to mention the millions and millions of older people and disabled people who really need a decent service. But that's the political calculation. So do we think the same thing's going to happen this time? Well, actually, I have a moderate hope that it won't. And the reason for that is actually all to do with the NHS. And I'm sure that Rachel's going to be talking about that, so I don't want to trespass hugely on her patch. But actually, the government, particularly in the wake of what's happened in America with the election of Mr. Trump, are now, as I understand it, in a position where they're thinking, gosh, if we're not careful, we're going to be in the same place in 4 or 5 years' time in this country. And the way to fend off that threat is to show the public that that we're making a real difference, and it's going to get easier to see your GP, to get that operation, that your money will stretch a bit further, the cost of living will feel less pressured than it does now, and that we're going to tackle those boats that are coming over bringing people. Those are the things they're focusing on. And that's a ray of hope for social care, I think, because Wes Streeting cannot sort out the NHS unless and until social care gets sorted out too. And he knows that really well. And I'm sure that's what he'll be saying to his colleagues on Monday. So it really won't do this time just to try and kick the can down the road, leave it to the next lot. They are going to have to do something, and do something quite significant, I think. And I'm seeing that too in the role that we mentioned just at the beginning of chairing this group for the NHS plan. I'm chairing a group. It's all about multimorbidity and complex needs. And the government's agenda, which I have to say I completely agree with, and I think lots of people agree with, is we need to do more to help older people living at home get help to them quicker so they don't end up having to go into hospital for help that could have been given much earlier on. Let's do more to help older people stay fit and well at home. It's all about getting GPs working better with district nurses, but you can't do it if social care isn't part of it as well. There's so many older people who've got health needs, who've got social care needs too. So what are we going to do about social care? And I don't think this government can duck it in a way that predecessors have. So that's my ray of hope, because it's on this horrible, nasty Saturday afternoon where the weather's awful. I want to leave us with a ray of hope. So I am optimistic that they will have to do something, arguably for the wrong reasons, in the sense it's not out of moral duty, which some of us might think is what matters, but because politically they can't afford not to. Let's keep hoping anyway.
Caroline, what a wonderfully optimistic note to end on. Thank you so much.